out of 6 men will be diagnosed with prostate cancer during their lifetime, but lives are saved when this disease is caught and treated early. Here to tell us about new breakthroughs in diagnosing prostate cancer is Dr. Bernard Gburek with Arizona Urology and Dr. Ray Murphy with Scottsdale Medical Imaging. Good morning.
Good morning.
Good morning.
I mean, really, the numbers 1 in 6, it's staggering. Dr. Gburek, let me ask you, what are the challenges that you face when diagnosing prostate cancer?
Well, some of the challenges that we face are to diagnose the cancer as early as possible. And right now, some of our tools that we have to make that diagnosis they're good, but they could stand for some improvement. We currently use a blood test called the PSA test that when it's elevated can indicate the presence of prostate cancer, and we use an exam on the prostate, digital rectal exam, to tell if cancer could be present.
And for people, when should men start getting their prostate checked? And I know we have a picture of, what is going to happen when it happens, when cancer takes over. Tell me about this.
Well, this is, the prostate is located just below the bladder, and when cancer takes over, it actually can be fairly silent in terms of its earliest manifestations, because until the cancer gets to be quite large, it really won't cause any symptoms such as urinary retention or difficulty emptying the bladder. It really has to be determined in these early manners via the blood work or the exam.
Now, when it comes to a biopsy, what's involved in that?
What's involved with the biopsy is biopsy is done via the rectum. So an ultrasound probe is placed into the rectum. And currently, using our current techniques, there's a total of 12 samples are taken of prostate tissue, 6 from the right side, 6 from the left side, in those areas that commonly will harbor cancer. But it's somewhat undirected. We use ultrasound guidance to guide where those biopsies are going to be taken, but only about 20% of the time are the tumors actually seen with a biopsy on the ultrasound.
So, Dr. Murphy, let me ask you, how does this advanced medical imaging help pinpoint the accuracy of these biopsies?
Well, Suzanne, as Dr. Gburek mentioned, that in a number of cases, we don't find the tumor. And what this new technique, which is called multi-parametric MRI, or we call it MP MRI for short, helps us do is to look at the tumor and evaluate not just its location but its behavior. So we actually look at things like blood flow or architecture of the cells in the tumor to help bring it out so that we can see it effectively. And once we can see it, then we can go about targeting it better. And this test is a...
Which we have some pictures of, and if you can kind of just walk us through what we're looking at with this imaging.
These images show what we're doing here is looking at blood flow to the tumor, and it allows us, in a very short exam of only 30 minutes, with non-invasive and safe, no radiation, to uncover the tumor so that we can then tell our urologist colleagues where to target with the biopsies the second time around to obtain a good diagnosis.
And what's next for this technology at Scottsdale Medical Imaging?
Well, what's next for this technology is a new technique, which we're in the process of obtaining, and that allows us to take the three-dimensional images from the MRI and to marry those together or link those together, fuse them with ultrasound imaging that the urologists use to target the tumors, so that you have a very beautiful three-dimensional image in Dr. Gburek's office, where the machine simply lights up a red dot on the real-time ultrasound image, and he points his biopsy gun at that red dot, and the tumor is obtained. And
so, doctor, you see it firsthand. How does this imaging affect the outcome for these patients?
It's really has great promise for the patients, because currently, with under the current techniques, with taking 12 somewhat random biopsies into the prostate, one can really see a time where there can be fewer biopsies that are more directed, where the accuracy of the biopsies are going to be improved by taking biopsies only through those areas that have abnormalities, and where the yield will be in finding cancer, earlier diagnosis, and even down the road the potential then for guiding focal therapies rather than having more radical types of interventions.
A lot of great information. Thank you so much. And quickly, we want to reiterate, what age should men start getting their prostate screened?
Really starting at age 45 should start having exams and PSA tests.
All right. Thank you so much, gentlemen. A lot of important information. And if you would like more information about Scottsdale Medical Imaging, you can log on to their site, esmil.com, or call the number you see on your screen. And to contact Dr. Gburek, you can go to Arizona Urology Specialists urologyspecialists.com or call the number you see right there on your screen.